of history of communities of African descent and the more than 50 African Nova Scotia communities throughout the recent increase in hospitalizations across our community in the last week. And we want to ensure accessibility of this event for those who are more vulnerable to COVID by ensuring social distancing and masking, and while also ensuring that this event does not worsen the COVID situation here in Nova Scotia. On top of that, please make sure you take care of yourselves and the people around you, both physically and mentally. This is a very difficult time for many people in a lot of different ways. For people who are experiencing dehydration, first of all, stay hydrated, but if you do experience dehydration or any other basic crisis, we have water and snacks up here for people who experience any issues. If you're feeling faint, just please come up and take some. It's a free-for-all for them. And we want to thank some of the members of the community for donating those items. I wasn't going to add this, but I decided to add it last minute. After today, please consider donating to some nonprofit organizations in Canada and the United States, providing access to abortion and sexual health care. Not us, not GACNS. We've already received donations today. We're not the ones that need it right now. Please donate to people who are providing these services, sexual health services and abortion services here in Canada and the States. Do not donate to us, please. Please consider donating specifically to Action Canada and Abortion Support Services Atlantic. I now want to get into what today is about and what today isn't about. We're here today to stand in solidarity with those in the United States whose natural rights are being violated. Bodily autonomy is intrinsic, and no government can take away the right to bodily autonomy. They can, however, make it more difficult to exercise people's rights. We stand with solidarity with all those who have had protections of their rights to abortion and other sexual health services challenged yesterday, while recognizing that we here in Canada do not face the same challenges to our rights. We are not here to call for the legislation of abortion access in Canada. Abortion here in Canada is decriminalized. Our issue here is not to legislate it, it's about funding and access to abortion and sexual health services. No criminal law in Canada tells us how and when abortion can be offered or accessed. Abortion in Canada is considered a medical procedure. Creating a bill to guarantee the right to an abortion opens the door to those who seek to limit access and rights to these services. If you want to learn more about why we are not calling for legislation here in Canada to guarantee access to abortion, please visit abortioncanadashr.org to learn more. We also recognize that abortion care is not only for cisgender women, but for trans, intersex, and gender diverse individuals who also have their intrinsic rights challenged as of yesterday. And they deserve space and conversations about reproductive health, and as well as discussions about healthcare in general. We want to further recognize that Black and ANS individuals, Indigenous persons, and persons with disabilities are disproportionately impacted by any restrictions to the right of bodily autonomy. We need to reflect on who is most at risk in these conversations and make sure that we are cognizant of our racist, anti-Indigenous, and ableist reality in which these discussions are occurring. With that, this rally has 6 calls to action. The first is the recognition that abortion is health care. The second is that medication abortion is primary care. Third, a permanent increase to the federal health transfers to ensure access to abortion and sexual health services here in Canada. The creation of a Health Canada web portal providing accurate, unbiased information on abortion and sexual health services. A permanently funded Canadian Sexual Health and Reproductive Health Fund, and no new laws regarding abortion access in Canada. We have several speakers here today. We have 2 speakers here today, that is, to discuss abortion rights and access in Canada and how we can best stand in solidarity with those impacted by the States and in other parts of the world where abortion access is also restricted. And first up is Dr. Martha Paynter. Dr. Paynter is a registered nurse working in abortion and reproductive health care. She is the founder and director of Wellness Within, an organization for health and justice, and received a Doctor of Philosophy from Dalhousie University in nursing. She has 20 years experience working to advance health equity. Her practice, teaching, and research focuses on the intersection of reproductive health and the justice system. She is the author of Abortion to Abolition, Reproductive Health and Justice in Canada, which was published in spring 2022 by Framework Publishing. Please welcome.
Yesterday, the U.S. Supreme Court overturned Roe v. Wade, a 1973 ruling that the U.S. Constitution afforded protection to the right to abortion. Individual states now may, and several already have, banned abortion outright. As an abortion care provider in Canada, I feel deep solidarity with colleagues south of the border and terror for their patients. Abortion care affirms the dignity and autonomy of patients and translates into not only physical and mental health, but also opportunity for education, employment, safety from violence, and parenting wanted children. Providers and policymakers in Canada can and must respond to U.S. abortion bans by expanding access to care here. In Canada, abortion is completely decriminalized. Abortion is healthcare and is no more governed by criminal law than knee surgery or IV antibiotics. There are no legal limits to gestational age or mandatory waiting periods or requirements that youth seek parental consent. It is publicly funded like most physician and hospital provided services, with a few exceptions. And since 2017, all primary care providers, including family physicians and nurse practitioners, have been authorized to prescribe mifepristone for medication abortion, except in Quebec. Because there is no abortion law in Canada, there is no law for conservative politicians to demand be reformed to limit access. There is no law that providers of care must tiptoe in between to avoid prosecution. We must keep it this way. In the past 7 years, logistical access to abortion in Canada has improved significantly. Some people don't know this. New Brunswick introduced self-referral and solidified surgical services at 3 hospitals. PEI opened a comprehensive program with 2 sites. Nova Scotia centralized referral to a single toll-free line. And most importantly, medication abortion prescribing democratized across primary care. Even COVID-19 protections resulted in care expansion. As providers became more familiar with telemedicine, many felt comfortable moving to what we call no-touch or low-touch medication abortion prescribing without requiring blood work or ultrasound. Because interprovincial travel restrictions limited our ability to refer patients elsewhere if they were past our local gestational age caps, hospitals in several provinces made the necessary and permanent infrastructural and training adjustments to extend the gestational ages to which they would provide care. But serious limits on abortion access in Canada remain. This is a huge country, and people living in rural, remote, and underserved areas face enormous travel burdens to access care. These burdens are greatest for people facing poverty, intimate partner violence, and racism from the healthcare system. And access challenges may be greater if we suddenly see an influx of patients from the U.S. Because healthcare is administered at the provincial territorial level, access and practice norms among the provinces vary widely and unjustly. This is the case for all kinds of healthcare, not just abortion, but abortion is basic and common. It's not neurosurgery. Consider how there are 49 surgical abortion sites in Quebec, by far the highest number of access points, but Quebec has the lowest uptake of medication abortion because of rigid requirements about prescribing authority. Meanwhile, although there is only 1 surgical site in PEI, more than half of abortions on the island are through medication. In Newfoundland, 95% of publicly funded surgical abortion takes place at a freestanding family practice clinic, Athena. Yet, New Brunswick has kept a perverse piece of legislation on the books for decades, 8420 of the Medical Services Payment Act, denying public insurance for surgical abortion outside of a hospital building. 1 in 3 people in Canada with a uterus will have an abortion in their lifetime. The arrangements for care should not be so convoluted and unequal. There will undoubtedly be escalating rhetoric from anti-choice politicians in the wake of the fall of Roe. Now is the time to leap forward in terms of access in Canada. Healthcare providers, policymakers, activists, and everyone can channel our horror into meaningful and specific actions to enthusiastically expand abortion. We need to ensure all medical and nursing schools include robust abortion components in their curricula to increase provider knowledge, competence, and confidence with abortion care and reduce geographic disparities. Nurse practitioners and midwives should be authorized not only to prescribe medication abortion, but to perform aspiration surgical abortion. Quebec must get on board with welcoming primary care providers as medication abortion prescribers. We should nurture abortion provider networks for mentorship and support to improve confident uptake of no-touch mifepristone prescribing and availability of abortion in rural, remote, and underserved communities. We must have universal coverage for contraception for everyone and explore offering contraception and mifepristone over the counter as we do with Plan B. And finally, we must make sure every person understands how abortion care works here, normalize it as a health service, and resist any attempt to bind it up in a law that could someday be altered or taken away. Poverty, stigma, racism, and gender violence are persistent barriers to abortion in Canada. If we are worried about threats to access, these are what we need to fight. Thank you. Thank you.
Thank you so much, ma'am, for that. Summarizes exactly what we're here to discuss today. With that, I want to welcome up our second speaker, Shannon Hardy. In 2006, Shannon co-founded the Nova Scotia Doula Association, and then in 2012, founded the Abortion Support Services Atlantic. ASSA supports anyone needing an abortion in the Atlantic provinces through funding, transportation, and finding accommodations. Shannon is a social worker and a therapist who specializes in trauma-informed approaches and practices. She created the first trauma-informed abortion support workshop in Canada in 2017. She is proud that Abortion Support Services Atlantic is celebrating its 10th year and will be working with Gender-Affirming here in Nova Scotia. Thank you. I hadn't read that before, so. When other people cry, I start crying, so that wasn't helpful. All right, so great lead-in. Thank you, Martha. Oh, sorry. Is that good? All right. Okay. Great lead-in, Martha. Thank you. So those are the issues as laid out by Martha, right? What do we do? Right? It's not enough to be like, oh, it was so terrible and we feel so bad. We have to do something, and that is exactly why I started Abortion Support Services Atlantic. I was so angry and rageful that people couldn't access abortion care. So I'm just going to be here to tell you about what we do, all right? So we gather funds to help people travel. So we offer gas money or babysitting money or just snack money if that's what they need. We offer transportation if that's what they need, so they don't have their own car or somebody to bring them in. We organize volunteer rides. We organize accommodations, so we use hotels for people to stay in when they come into Halifax or anywhere in the Atlantic provinces. And we help people with logistics when they have to leave the province for abortion care, because
We have an arbitrary cutoff of 15 weeks, 5 days here, and if you're over that, you have to leave the province. Yeah, so the only thing I really wanted to say today is if you feel like there's nothing you can do, if you're feeling like it just feels overwhelming and the politicians are just going to do what they're going to do, there is. You can check out Action Canada, you can check out the National Abortion Federation, Abortion Rights Coalition of Canada. There's so many groups doing this support work. You can write to your politicians and say, this is what I'm angry about. Why is access so hard? Why do we have to jump through these hoops? There is a lot you can do, and that was the reason I came here today. I just wanted to let everybody know that we have a voice. And there's groups out there doing this work, and you can join them. Thank you. Just gonna get my notes out.
With that, that's the end of our speakers list for today. I welcome everyone to stay, talk with each other, make sure everyone is okay and feel supported in this process. I know a lot of us are struggling right now. I want to first thank everyone who participated in the organizing of this event. Kieran Sharma, Abby Ferguson, Alia Paris, Shannon Jones, Scott Domier, and Liz Lachère. I of course want to remind you all to remember to support organizations providing increased access to abortion and sexual health services here in Canada, as well as donating to organizations in the state that are working to fight to ensure and enshrine abortion and sexual reproductive health rights. Please remember to take care of yourself. If you are feeling thirsty, please come take a bottle of water. Get free, come take a bottle of water. Feel free to have a bottle of water.
Hi, I'm not on the speakers list, and I just sort of read about this on Instagram and showed up. My name is Dr. Lianne Yoshida, and I am the medical director of the abortion clinic at the hospital. And I just want to thank everybody for coming today. I've been an abortion provider for 22 years. I was trained by Henry Morgenthau and worked in the Morgenthau Clinic in Shannon. I was able to have the honor of standing on the shoulders of all the people who came before me to provide PEI, to have a clinic. So I got emotional, and I was able to do the first abortion in PEI in January 2017. And I used to be shy about putting my name and face out there in the media as an abortion provider, because when I trained in the year 2000, it was still dangerous to be an abortion provider. And when I was in medical school, there were death threats against the doctors providing abortion. And that was one of my motivations to become an abortion provider. And I can't actually believe I'm actually speaking in front of everybody today. So, I just want to say thank you to everyone. And as Martha, my colleague and amazing person, and Shannon, another amazing person, and all of these people in Nova Scotia, and the Maritimes, and Atlantic Canada who have been fighting to increase access. And since I moved here in 2004 and started working as an abortion provider, the landscape of abortion access is so transformed. As we've mentioned today, though, there are still a lot of things on my to-do list to continue to expand abortion access. And with great colleagues that I have, I know we'll be able to continue to achieve things. And that's my call to action, and I want everyone else to think about what they can do to just increase reproductive justice, which is everything from abortion to childcare, to reproductive health access, to criminal justice, and everything is all part of the same thing. And thank you for coming today.
Thank you so much. Thank you, Yoshida. unexpected but perfect way to end today. Thank you so much for coming out and being willing to speak. Like, honestly, thank you. With that, again, there is water here. There are some snacks here. And again, everyone, please stay safe. COVID's still around us. Please stay safe. Please make sure you're contributing to these conversations productively. Please making sure you're standing where you can in solidarity with people in the United States and even people here who have limited access to access their right to an abortion. Work to encourage changes within the system and provide protected funding for these services as comprehensive health care. And a reminder that abortion and sexual health care is gender-affirming care as well. Please include trans, intersex, and gender diverse individuals in your conversations about this issue. And that's all I have for you guys today. Thank you for coming.